Thank you, Senator Burst. And Senator Ketter.
Yes, thank you very much, Mr Acting Deputy President. And I rise to speak on the Aged Care Single Quality Framework Reform Bill. And Mr Acting Deputy President, if there was one area of government policy which one would have thought required bipartisanship, it is the care of aged Australians. I think this is an aspect of the debate that is being neglected at the moment. On this side of the chamber, we are passionate about our aged care sector, and I'm no doubt that on the other side there are people who care about this issue. But the evidence is that this government has presided for 5 years over an aged care crisis, which includes not only a crisis in the residential system, in the home care system, but also in relation to the workforce. This government is doing nothing to address the crisis in our aged care workforce. So we all need to be committed to improving the aged care system. And it's one thing to talk about standardising the quality framework across the various parts of the aged care sector. That's important. But I would suggest that what the average Australian is more concerned about is whether or not the standards can actually be delivered out there in the sector for their loved ones. So on this side of the chamber, we do have a track record in relation to bipartisanship. In the previous Labor government, there was a lot of consultation involved, and there was the hand extended to the other side to get involved in policy formulation. And I understand that our Living Longer, Living Better reforms were the result of an attempt to bring about bipartisanship to this sector. And we delivered a $3.7 billion Living Longer, Living Better reform in our last term of federal government. And for the benefit of those listening to this speech, I just wanted to recap on some of the aspects of that $3.7 billion program. It included $955.4 million to help people stay at home through an integrated home support program, more home care packages with new levels of packages, greater choice and control through consumer-directed care available across all new home care packages, fairer means testing arrangements for home care packages, $54.8 million to help carers access respite and other support, $660.3 million to deliver better residential aged care through more residential care facilities to be built, supporting the viability of services in regional, rural and remote areas, trialling consumer-directed care and residential aged care, strengthening means testing for residential care by combining the current income and asset tests, establishing a new aged care financing authority, and improving the aged care funding instrument, $1.2 billion to strengthen the aged care workforce, $39.8 million to support consumers and research through empowering consumers through advocacy, better connecting the lonely and socially isolated, improving the knowledge of older people's care and support needs, $80.2 million to ensure better health connections through complex health care, multidisciplinary care, service innovation. So it was a comprehensive package, and we invite those opposite to steal our policies from time to time. Unfortunately, that doesn't happen often enough, but we do have a proud record in investing in aged care, in our seniors and in aged pensioners. But that's no surprise to anybody who has an interest in support for communities, because people would know that it was Labor that legislated for industry superannuation. It was Labor that legislated for Medicare, the safety net. It is Labor that began the National Disability Insurance Scheme. And I want to take a brief moment here to pay tribute to the phenomenal work that the Honourable Jenny Macklin did in conceiving the scheme, along with our federal Labor leader, Mr Shorten. Now, Labor supports measures intended to make later life better for Australians. Mr Acting Deputy President, they've earned it. And that's why we're supporting this bill, which amends existing acts to provide for a single set of aged care quality standards to apply across aged care providers under the Aged Care Act and varies the functions of the CEO of the Aged Care Quality Agency to reference the new standards. The new standards will come into effect from the 1st of July next year and will cover 3 different areas: residential aged care, home care, and the National Aboriginal and Torres Strait Islander Flexible Aged Care Program Quality Review. However, I do want to point out some of the concerns that we have in this area. The government has dragged its feet on this reform, like in so many other important reforms: payday lending, banking accountability, and superannuation, just to name a few. It is Labor who has had to drag this government kicking and screaming to these reforms. These particular reforms that we're considering today have been talked about since 2015, but it's only now, 3 years later, in 2018, the government is bringing them to the Parliament. Now, perhaps if this chaotic government spent less time on shuffling the deck chairs and the infighting, Australians, particularly older Australians in need of care, would get the attention and respect they deserve. Now, Labor also has concerns about the extension of the Freedom of Information Act 1982 to exempt some documents from disclosure. And with scant detail on what these exemptions would be, Labor has ongoing concerns about the transparency and truthfulness of this government, and I'll touch on that a bit later on. Now, as I've indicated, we have an aged care system in crisis, and there are significant challenges ahead of us in this industry. We have 2.49 million people, or over 10% of Australia's population, aged 70 or over, as at the 2016 census date. And I think, Mr Acting Deputy President, by around the year 2050, I think that proportion is set to double to around 20% of the population would be aged 70 or over. As at the 30th of June this year, over 200,000 people were living in residential aged care facility. And we know that this is a sector that requires a lot of government support. $17.4 billion was spent by governments on aged care in 2016-17. 69% of that was for residential aged care. We know that women outnumber men in aged care services 2 to 1 because, of course, women live longer and have higher care needs. People spend an average of 2.5 years in permanent residential care, just over 1.5 years in home care, and 1 month in respite care. Aboriginal and Torres Strait Islander people account for less than 1% of all people in permanent residential care and 4% of people in home care. So these statistics just illustrate the size of the issue that we are dealing with. In delivering our landmark aged care reforms, Living Longer, Living Better, Labor acknowledged a number of challenges in the aged care sector. These included the matter of choice. We recognised that older Australians often preferred to age at home, and we provided more support to enable them to make that choice. We recognised inequities in the costs of residential aged care and took steps to ensure more protection for the most vulnerable. We recognised that volunteer carers, a critical part of our aged care system, needed more support. We strengthened links between the aged care and wider health system, particularly with a view to improving support for the increasing number of Australians diagnosed with dementia and Australians requiring palliative care. And a key feature of our reforms was to recognise and take steps to address the workforce pressures in the aged care system, namely the need to attract and retain trained, qualified staff in the sector. I think, Mr Acting Deputy President, we need approximately 3 times the number of people working in our aged care sector. So to this end, Labor committed $1.2 billion over the 5 years for an aged care workforce productivity strategy, including a workforce compact to improve wages across the sector. And those opposite will recall that in 2013, almost immediately upon attaining government, this was one of the very first measures that the Abbott government sought to scrap. And I will be coming back to this later when I talk about the dismal record of those opposite when it comes to appropriate wages for workers in our country who look after our most vulnerable people. Just continuing with the challenges that we have in this sector, the issue of dementia, I think, is first and foremost. Most people nowadays now have a family member or know of a friend, a work colleague or an acquaintance with experience of dementia, whether it's age-related or a tragedy of younger onset dementia. Now, I want to echo the words of Mr. Shorten, who said in November of last year that tackling dementia will be a defining health and aged care challenge of the next generation, and that it is our generation's duty to get started. And I think in a seminal speech from Mr. Shorten, he's identified that this matter is one which has touched him quite deeply, and I think he has a genuine concern about this particular issue. He pointed out in a recent speech that a NATSEM report has estimated that dementia costs Australia over $14 billion a year. The same report found that even a 5% reduction in the number of people with dementia over the age of 65 could lead to savings of $120.4 billion in less than the next 40 years. But if we hold to our present course, more than 500,000 Australians will have dementia by 2025, more than 1 million of us by 2050. 1 in 3 Australians born today will eventually be diagnosed with dementia. And already this year, for the first time, dementia is now the leading cause of death for Australian women. And within the next 5 years, it will be the leading cause of death for all Australians. So this means that we need better standards and training for residential facilities and for in-home care. And to that extent, we support the elements of this bill that go to that. But it's estimated that 70% of people in residential aged care have dementia. So everything we do in aged care policy has to link up with dementia policies. And Senator Burston has touched on some of the reports of elder abuse that's been, or substandard aged care that's occurred that we do hear somewhat all too often in the media. And unfortunately, it's possible that that's the tip of the iceberg, and this goes to the issue that we do have a crisis in this sector. And Mr. Shorten has noted that addressing this issue is within our grasp. We do have the resources and the capacity to deal with it. We just need to be better at utilising those resources. And the challenges of dementia care, and I don't need to tell you this, Mr. Acting Deputy President, are amplified in rural and regional Australia. And in February this year, I instituted in this place a Senate Economics References Committee inquiry into regional inequality. And the terms of reference of that inquiry were deliberately broad, so as to allow us to examine a whole range of drivers, including health and aged care. And last month, on the 29th of August, the committee held our first public hearing in Emerald, in central Queensland. And I just wanted to take a moment to make reference to submission that we received from Ms Gay Cypher to the inquiry, which, and the focus of her submission, and she appeared before us as a witness, was to focus on the lack of sustainability for the aged care industry in regional and remote regions based on the current business-driven model. And Ms Cypher is most familiar with the central and central west Queensland examples. And an examination of the data shows that access to residential aged care in remote and very remote communities is extremely limited. Private providers are not found in locations that operate on marginally sustainable business models, such as those you find in remote or very remote communities. So the consumer choice is constrained, and there is more of a need for legislative requirements and regulation to guarantee access to residential and community-based aged care of an acceptable level. So the aged care provision in rural and remote areas may be limited to 1 or 2 providers, Ms Seifert told us, who have less need to compete for custom through marketing or self-promotion than metropolitan counterparts. So her recommendation is that it's important for service providers to collaborate to innovatively develop models of care that will work in rural and remote areas. And so she's advocated on behalf of aged people to the federal government to consider all of these sorts of things. I wish there was some evidence that the government is taking on board some of these ideas, but unfortunately...
Order, Senator Ketter. Senator Ketter.
Thank you very much, Mr Acting Deputy President. And I was speaking about some of the regional challenges associated with our aged care sector, and in particular the workforce for the aged care sector. But with every challenge there is an opportunity for regional Australia, and I think it's important to note that TAFE, which has for so long been neglected, provides that opportunity for filling the gap there for training for our aged care workforce. And Labor is committed to revitalising this long-neglected sector. And I've seen this firsthand, Mr Acting Deputy President, my recent visits to regional Queensland, going to the Roma campus of TAFE, where they have outstanding nursing training facilities there. Unfortunately, they're not being utilised to the extent that we would like them to be, but they are outstanding facilities, and I'm sure that they will find students for that campus. I've also seen the Townsville campus of TAFE last week, and also very good facilities. And I'd like to commend the Queensland Government for injecting $26 million there for in relation to a new building which is being constructed there at the present time. And recently, a couple of weeks ago, I visited the Mount Isa campus of TAFE, where they provide courses in relation to health and aged care. So it's so important that this training be delivered in regional Australia, so that we can have opportunities for regional Australians to age in their locality. But in order for us to realise the opportunities that exist with these challenges, Mr Acting Deputy President, we do need a federal Labor government. And even before the chaos of this Liberal National Government claiming another Prime Minister and paralysing positive reforms, those opposite had already started to wreck Labor's aged care reforms, taking $2 billion ripped out of aged care and cutting the $1.2 billion Workforce Compact Fund. And unfortunately, the new Prime Minister has not acquitted himself well in this space. In fact, would argue he's failed his first test because he has not included aged care in his new cabinet. So this does not give us a great deal of confidence that this issue of aged care and the crisis which is confronting the sector is going to be addressed by this government. And in one of his first acts as Treasurer, Mr Morrison slashed almost $500 million from aged care funding in the 2015 MYEFO. And as other speakers have said, we have 108,000 Australians on the waiting list for home care packages, and the latest budget did not deliver $1 new of funding for aged care. What's most concerning to me, and I think Australians would be concerned, of that 108,000 Australians waiting for home care packages, 88,000 older Australians waiting with high needs, many with dementia. So that is a crisis in anyone's language. Mr Acting Deputy President, Labor believes in a helping hand for those who need it most. We follow through with our values by investing in affordable health care, education and fair pay for fair work, especially for those workers caring for our most vulnerable Australians. Now more than ever, we need a Labor government to restore the balance of fairness in Australia.